Hi everyone, my name is Cambies. I am here to talk about the interview I've done in person on June 10th with Megan, a nursing supervisor at the Ranch Recovery Center. Megan is currently midway through her second year as an F&P program. During her career as a nurse, she's worn different hats. She's been at the medical surgical unit. She's done social work, case management. She's worked as a analyst, clinical analyst. She's worked at ICU unit for 2 years, all out of Minnesota and Utah. She has been working at the in California for the past 5 years. In a mental health facility called the Ranch Recovery Center. They use Kipu for their electronic health record. One unique question I asked her for my own curiosity was that I know you're in the second year of F&P program and your current plan is to work as a clinician, but have you ever considered taking on a nurse informaticist role sometime in the future? She replied, I haven't really thought about it. The school I'm in did not require us to take an informatics course, so I don't know too much about the education that's required. But she said, I do know that when taking on a leadership role in nursing, your job description is going to include informatics in one form or another. Leaders must know what's going on. And technology will tell me what's going on within the organization. And with that information, I, as a leader, can enhance the services we provide for those we serve. She said, I wear different hats in this organization because we operate at a small scale. Most hospital nurse informaticist job is solely focused on safety, compliance, education, improvement, and statistics. That would be a good retirement position. I will update you when I'm in my 60s. This answer was pretty interesting for me and surprising. But what surprised me even more was that their safety guard technology they have in Kipu. She said there are many antidepressants and antipsychotic medications that cause severe adverse reaction when taken with certain foods or medication. For example, some MAOIs they don't act well, mix well with thiamine-rich foods. They can cause severe hypertensive crisis. For example, she said when I'm administering phenelzine, I always get this red flag for me to educate the patient to avoid consumption of smoked meat, fermented food like soy sauce, tofu, kimchi, and cheddar cheese, and all over-ripened fruits. That was really interesting to know that their technology has those flags, and that their facility is a psych facility, so obviously they have all psych patients, 70, she said, an inpatient, and 10 at all times in detox. And they are all, just about, she said, 95% of them are on 2 or more medication. And just remembering all the interactions between food and medications would be very difficult for someone to memorize. One insight I gain from my own experience is to be more patient and understanding with nurse informaticists in our ER facility. There have been times when I had to make charting corrections or update notes, especially when charting 5150 patients that are on strains for every 15 minutes. And there is, as we all know, there's a lot of stuff that we have to do. During the time that I'm overwhelmed with charting, I could be more considerate and understanding that that the nurse informaticists are doing their job, sort of. This interview broadened my view of informatics, where especially when Megan told me that as nurse leaders, informatics will be in the forefront of all of our duties. Technology not only organizes, secures, and stores data, it reveals how an organization is functioning through statistics. And understanding this as a master's prepared nurse gives me a better perspective on why we collect certain data or charts the way we do. I will be more precise when collecting patient information with this understanding. And perhaps the stress of charting during codes or STEMIs may be a little less painful. Thank you for listening, and I hope you liked my interview.